recovery is showing 90%. All my blood markers are normal, but I'm still not feeling it. I'm having a lot of hair loss, but all my vitamins and minerals look okay on the blood report.
I think
What are the main symptoms that one should never ignore when it is presented?
skin, energy, something like
What is the cost of not getting an expensive test today, which can come and haunt somebody later in the future?
first thing.
What are these 5 things that are like the pillars which are non-negotiables? Any patient, any client, any member who walks inside your office, you're anyways addressing. What are those 5 pillars?
These are very free things people can do even without getting a test done, right? One thing.
People usually visit a doctor in general when there is like a pain or a pressing problem, their day-to-day life is affected, and they are not able to go forward and do their functions for the day. That's the main objective behind somebody visiting a hospital or a doctor as such. Why do you think the healthcare is also facilitating only that? And what are you doing differently currently at our practice, which is changing the picture?
Since so long, that is how we are trained, right? We have a problem, we go visit a doctor, find what the solution is, and we start fixing it. So the system was all about fixing and diagnosing a disease, detecting the disease. Okay, but while the advancements in the medicine has happened, while looking for solutions, amazing advancements have happened in treating acute illnesses or acute care. I think prevention went on a back burner, I would say. We had preventive medicine as a part of the entire healthcare ecosystem, but it was neglected. Now with the development of so many chronic lifestyle diseases, now again preventive medicine is back again. It's not like it was never been, but it's just that now we can detect disease much more earlier than what we were doing before. So I think precision diagnostics have come, and there are variables that we can detect changes more quickly and more often at a difference of 24 hours to 48 hours. So I think advancements in the precision diagnostics have come in, and now every doctor also has started to see people in different lens. Why should I even wait for the disease to take, to move into different stages, like end stage where treatment becomes difficult, and quality of healthy years also will come down. So since we want more number of quality healthy years, not just increasing the lifespan and keeping patients in the bed with procedures and pills, but we want to increase the functionality of individuals and improve their health span, identify disease as early as possible and delay it. I think this is the entire purpose with which we started seeing individuals. And we started using those precision diagnostics and repurposing the existing tests in little more at a cellular level. For example, a CBC is there. We can make the most out of it. Like how we were discussing other day, as simple as changes in different kinds of WBCs can give us some insight into what is happening in the inflammatory pathway, immune system, etc. So I think the interpretation is changing. The way we look at the individual is changing. Not every time blood picture gives everything about an individual. We need to ask some questions. So the way we question the individual is changing. So I think that is what we are doing.
Yeah. So with more and more people having access to biomarkers that can be tracked on a daily basis, and more people getting awareness about, I can do so much with my health, they are getting their blood tests also done more frequently, and they are asking the right questions to the healthcare providers and trying to see what all can be done better. But increasingly, with access being democratized, we also see individuals saying that my recovery is showing 90%. All my blood markers are fine and normal, right? But I'm still not feeling it. My day is still sluggish. My HbA1c is at 5.5%, but I'm still feeling very drowsy after every meal, and I am urinating multiple times in a day, but my HbA1c is saying no. I'm feeling very tired, but my anemia is not there. I'm having a lot of hair loss, but all my vitamins and minerals look okay on the blood report. Why do you think this occurs, and what one can do in order to change this?
I think you stated the very problem with which clients also come to
Yeah.
us. This is the problem entire population is facing, because all these years we have only practiced population based medicine. So I
Yeah.
think that's the reason why these symptoms were left behind. Now we are moving to personalized medicine. That is where we want to look individual, as a whole, and not just with blood reports, but how they wake up, to what they eat, in which order, and what they do before eating, after eating. All of these change the way they present themselves, with post meal drowsiness or fatigue throughout the day, or feeling like crashing at 2 p.m. All of these things, right? So it depends on what they eat, how they eat, when they eat, how much physical activity they do. A lot of lifestyle factors are coming in. And with the amount of data that they have, not everybody knows how perfectly to interpret it, right? That
Yeah.
is where we come in. That is how we help or guide the individuals to put everything together and interpret for them on how the lifestyle is modifying their functionality, and how not everything can be found out in regular blood tests. That is why we start doing fasting insulin instead of just HbA1c. We have seen this HbA1c is well within 5.3 to 5.6 for most individuals, but how many are we seeing with insulin resistance?
Yep.
So, but now people are even aware of doing this test, home IR or fasting insulin. I think, yes, there is awareness. Yes, there is a purpose of living, healthy living has come in. It's just the interpretation that is needed. So I think approach should be there. They should meet the right physician. They're asking right questions. I think they should find right solutions.
Mm. We have talked about all these signals that one should never ignore time and again, but since it's the need of the hour during this conversation, what are the main symptoms that one should never ignore when it is presented?
One-off symptoms once in a month is fine. But if
Repeated patterns.
repeated patterns, persisted symptoms related to skin,
Yeah.
energy, something like fatigue, which persists weeks together, months together, or multiple symptoms coming as cluster. There is joint pain also, there is a rash also, there is eye dryness also, there is inability to urinate or urinating more, or there's swelling in the feet, which is consistent and persisting for long, and these coming as clusters are the main things should not be ignored. Insomnia, not able to sleep for long, always feeling drowsy in the morning, unable to sleep in the night, or something like obstructive sleep apnea, or sudden weight gain, unexplainable weight gain should never be ignored. Similarly, persistent weight loss without any change in their lifestyle or diet should never be ignored. I think these are the few we have been seeing in the practice.
And to cluster it, so there is mood level symptoms. Am I feeling positive, upbeat, or am I having inconsistencies in mood? And there is sleep, initiation challenges, continuation challenges. Am I waking up feeling fresh despite doing everything right?
True.
And energy levels, are there so many inconsistencies through the days? Is it a roller coaster? First half is like a drag. Second half, I have some energy, but with that energy, I go and have a meal, and then I crash again, only to crash again. And then evening, it pick up, and it makes me stay awake and alert till about 2 a.m. and then I sleep. Bad patterns. And the gut itself, we know what the gut can present in itself, from acid reflux to nausea to vomiting to feeling bloated after meal and all of this. Go till I have a meal and I have a rash somewhere, and I have a meal and I have itchy eyes. All of these symptoms should never be neglected. And the aches and pains component as well. Any body pain which is persistent, which is irrelevant of what you do. You have gone to work out and you have pulled a muscle, that's fine. But through the day, there is some other pain which is coming in and is hampering one's day to day. One should not ignore.
Yeah.
So now, as a person, as a patient, right? Let's say I know I don't have something. I'm not in good shape. I realized and I've come to a conclusion that my health is not great, and I've taken my reports. It seems okay, but I know there is some dissonance going on, right? Now, what is it that I can elicit from a bunch of reports? Let's say somebody has given me everything that I need to be doing in terms of the biomarkers analysis, right? And I know as a person what all is going wrong. With this piece of information combined together, what can one elicit?
So you're saying there is a patient who got all the possible blood tests done and is going through certain set of symptoms. Okay.
which
So,
are non-typical. It's not very typical. I have air fall and I have low hemoglobin. I have anemia. I fix the anemia. Air fall gets better. That's very straightforward and linear, right? But I'm talking about all
non-linear things.
non-linear, unspecific symptoms that are presenting, and then there are a couple of things that are there on the reports.
Yeah.
So what is the algorithm that goes on your mind when you see a patient in order to help him or her explain
Good one.
about what's going on?
So this is where either cellular medicine or systems biology comes in, right? You don't start digging for a diagnosis for a single symptom. So we want to connect the pathways. Okay, what is happening in your gut? What are you eating? Is your gut producing the metabolites that keeps your brain, blood vessels, nervous system healthy or not? Or have you been having stress, lack of sleep, chronically inflamed, and are you having any bunch of antibodies which are positive? That means here again there is stress, there is gut, there is hormones, and there are autoimmune symptoms. All of these are interacting together. So, and also cardiovascular is not a very linear pathway that you have high LDL, so your cardiovascular system is at risk. No, but we have been seeing that, okay, you could have visceral adiposity, ApoB is high, HDL is low, and
omega-3 balance is off.
Omega-3 balance is off. That means you are far more inflammatory, carrying the burden of extra fat which you need not have, and that is releasing all the inflammatory mediators, and that is not just affecting your joints or skin, but it's directly affecting your cardiovascular health, because the interiors of the blood vessels are being affected. It is not able to release the healthy nitric oxide molecule that is supposed to keep blood vessels healthy, because people think, okay, arteries clog, so heart attack happens. But there are a lot of things that go underneath, right? There should be inflammation, nitric oxide should not be there, and again there should be the endothelial dysfunction. The energy production systems inside the cell, like mitochondria, should be functioning well. That means we should be exercising well. So that's an interaction or the interplay between multiple systems. So that's why we see, when we start with the gut, suppose we removed all inflammatory foods, the person started eating clean whole foods, we see energy changes, mood changes, cardiovascular health improves, the body composition changes. That means everything is so interactive, and not a single probiotic can do all of these for an individual. So I think we start looking at systems: gut, cardiovascular, cellular, nutrient elements, musculoskeletal system, then how is our neurological system. So we need to connect dots between all of these and start modifying all the things, like the 7 or 8 pillars that we often talk about: the sleep, stress management, nutrition, movement, the passion with which you're living, or the social relationships. All these contribute to how we thrive. So it is not linear. I think all these will contribute to all the different pathways that we're talking about. So I think the lens with which we see an individual should be different. It should be pathway oriented or systems oriented, rather than just looking at single systems.
Completely with you. And also that fatigue means different things to different individuals. And we can say that individual pathways, we can look at it and say that, is this person at risk of developing something today? What is baseline today? What are the things that one can improve to start off with increasing democratization of availability and increasing awareness of the things that are going on, and access to knowledge through platforms like GPT or Gemini or Grok or whatever. People get more confused with all this data and don't know what to do
with it.
That's where, if we have the stratification done and tell them, hey, you have XYZ things going on, and this is the main thing that you have to solve for, because it's boiling in nature. I think that's where our expertise come in, and then go and look at that as the first thing. We solve for it, because we know intuitively health is not binary. It's always inside the gray zones, and it is interplay of all the systems that you had mentioned coming together and causing one symptom, right?
True.
So
since you're talking about all of these things as an interplay, people know, okay, sleep is important, nutrition, I need to be moving. they know all of it. Despite that, they struggle to implement an action plan because it's too much or overwhelming sometimes. Or sometimes they think all that they have been doing is pretty decent and I'm sleeping well. I know I sleep well. But we have seen so many individuals who they think are sleeping are actually not spending the good amount of time in the restorative sleep and henceforth have problems due to multiple reasons. Either they fall asleep late, seeing a lot of blue light, watching TV while trying to fall asleep, or even have obstructive sleep apnea. We have seen so many people going through obstructive sleep apnea, not knowing the symptoms, thinking they're sleeping well. So, a lot of things. So, for this individual, the very first thing that we need to fix should be sleep, not everything at a time. Fix one after the other.
So this is one particular individual who has got access, who has got some resources to get into the crux of the problem, right? What about those individuals who feel, yes, I have problems, but these tests are very expensive. I can't get that hormone panel done. Fasting insulin costs 800 rupees, whereas my fasting blood glucose costs 20 rupees. What do you have to say about that?
The situation.
What is the cost of not getting an expensive test today?
That is there.
Which can come and haunt somebody later in the future.
Okay. First thing, a person is thinking about getting a test done because already he's struggling or going through something. Or there is some symptom. Or there is an age factor. Oh, I'm already 40. I think I should figure out what is going wrong. For any of the reasons, either they're not well or there is an age factor. In both the situations, the person need to predict or detect things early so that any delay might end up late diagnosis, disease onset, or even secondary problems or complications, which might put them in a situation where they have to spend more than before. So I think investing in primary or primordial prevention is very keen. When I say primordial, it's as simple as healthy habits that we begin from childhood, like playing outside, eating nutritious meals, getting vaccinations done. All of these are pretty basic and primordial. Primary is where we are building healthy sleep habits, nutrition, all of that. So when this is the place where more investment will actually make sense because you're building health here. And anytime you're spending into health architecture is more useful and you'll gain more health span than just the lifespan, or you end up spending more years on the planet but with lack of functionality. I think people should choose both functionality and healthy lifespan than just lifespan minus functionality.
What are these 5 things that are like the pillars which are non-negotiables? Which any which ways, any patient, any client, any member who walks inside your office, that you're anyways addressing it. What are those 5 pillars?
These are very free things people can do even without getting a test done, right? One thing, aim for at least 7 or 8 hours of sleep. At least you're not having a variable, it's still okay. At least aim for it. Even any change from 5 hours to 7 hours is a good change. So that is minimum and basic. To have time for yourself, by that we mean unwinding and stress management strategies, all of that, because all of us go through stress. There's no individual on this planet who is not stressful. So that is number 2. Number 3, nutrition. As much as possible, aim for whole foods, slow cooked, as much as possible, no seed oils, not deep fried, no ultra processed refined foods, etc. And 4th one is movement. Even if you're not exercising, if you're mobile throughout the day and not sitting like 8 hours per day, that's a win-win. We have seen this. Sitting is new smoking. So I think movement. Then 5th comes exercise. Now we know both are important. Both aerobic exercises and strength building exercises. Both are very crucial. I think these are the 5 minimum things that we all can do and still live a better life and prevent a disease. Maybe it's not measurable, but it serves the purpose.
Amazingly said. What's changing in healthcare today which excites you the most?
Okay. Person is already coming with a lot of blood tests, or we are ordering tests. That means there's more data about the single individual. And we are not looking at the population averages where I want to put this individual in this bucket where all of you fall in the same bucket. It's okay if you're as healthy as rest of the 80% of the population. No, don't want that to happen, right? If you are at a baseline at 50%, we want you to reach to 80% of the health. So we are not putting them in average population. That is changing. And three, since the client is already working with a lot of data, interpretation becomes time challenging, right? It's a time constraint for the doctors. That is where AI also is coming in to assist or guide the clinicians to spend more time with clients than spending time with data. So I think that is changing. I think people have understood or have become more responsible and more aware of health, because now they understand health is one thing that they need to invest in for sure. Uh, I think pretty much I told everything. But on the whole, it's exciting place that where we are heading from very reactive kind of medicine that we were practicing to the more proactive, more preventative healthcare that we are moving towards, and not just preventive medicine. We are moving towards 5P medicine, which is participatory. That is changing. Is in previous days, people used to come ask for a prescription, right, and take the prescription, but now they participate in the entire journey of building their health. So they are participants of building their own health architecture. So that is great. So it's precision, more precise for them, more participatory, more personalized, and more predictive and more preventive. So that is exciting.
Thank you for watching this video. In the last video, we broke a lot of myths around fat loss. If you find this video interesting, you might as well want to watch that one. Go check it out. If you haven't subscribed to PMX Health, please do subscribe.